Moments ago, President Trump posted a litany of medical misinformation days after telling pregnant women not to take acetaminophen. He just posted this, quote, "Pregnant women don't use Tylenol unless absolutely necessary. Don't give Tylenol to your young children for virtually any reason. Break up the MMR shot into 3 totally separate shots, not mixed. Take chicken pea shots separately. Take hepatitis B shot at 12 years old or older. And importantly, take vaccine in 5 separate medical visits." Because the president has put that out there, we feel it's important to fact check all of that. And joining us now is MSNBC medical contributor Dr. VIN Gupta. Dr. Gupta, so many people need your advice right now. Let's break down this post claim by claim. First, he says, don't use Tylenol unless absolutely necessary. Don't give Tylenol to your young children for virtually any reason. Can pregnant women and young children safely take acetaminophen?
They can. And this is, as you and I have talked about recently, there's the highest quality clinical research looked at 2.5 million children in Sweden. And specifically, it looked at children and it looked at siblings of children that took Tylenol or whose moms took Tylenol during pregnancy, compared it to siblings where those same moms didn't take Tylenol during pregnancy, so sibling matched studies. And what they found was that when you account for family genetics, environmental risk factors, all the things unique to a specific family, when you account for those variables, taking Tylenol during pregnancy or not taking Tylenol during pregnancy does not in any way increase your risk of autism. So it's important to recognize that best quality research does not substantiate what the president put out there. And I encourage all moms out there, if your child needs something for, say, a fever, whose child has not had a fever when they're young, that it's okay to take medications that lower your child's fever. There's no risk to that. And so his claim that you can't take Tylenol if your child needs it when they're young is also not substantiated.
What about the MMR shot, the measles, mumps, and rubella vaccine? Does it need to be broken up, as Trump claims? And does the chickenpox vaccine need to be taken separately from it?
Well, just fundamentally, I'm reading his post as we speak. Break up the MMR shot into 3 totally separate shots, not mixed, exclamation point, is what he put out there. I'm not sure who's advising him, but those 3 shots, measles, mumps, rubella, that's what constitutes MMR, that vaccine. That does not exist as monovalent vaccines. What does that mean? There is no single measles shot. There's no single mump shot. There's no single shot for rubella. It's a trivalent 3-in-1 vaccine. That's what exists, and you get them twice. Once between, say, 12 to 15 months of age, and once between 4 and 6 years of age. But no, there is no sort of 3 separate shots here. So I don't know what he's talking about. And take the chicken pea shot separately. I think he's referencing varicella. And that is something that, of all the things he just put out there in this tweet, that's something that the Advisory Committee on Immunization Practices looked at. And every credible medical body does recommend that you can split the MMR shot and the varicella shot between 12 and 15 months of age. You can split them. So the recommendation is actually to take the varicella shot, i.e. the chicken pea shot, separately from the MMR shot, and that's absolutely okay. And that's actually that was the recommendation prior to Trump being in office.
Okay, and then there's the hepatitis B vaccine that he talks about. He says children shouldn't take it until they are at least 12. And he says take vaccine in 5 separate medical visits. What does the science tell us?
So the hepatitis B shot at 12 years old, that's a very that's an astonishing statement, even given what we're used to from this administration.
Newborns usually get that shot, right?
Exactly. So that's a birth dose. And so for all our viewers out there, saying that you should take the hepatitis B shot at 12 years of age, when currently it's recommended in the first 24 hours of life, is a dramatic departure from just common sense medical knowledge. There's a reason we do this, Anna, that we recommend it at birth, because there's Unfortunately, a lot of babies, despite efforts at screening mom, still get exposed to hepatitis B, which can cause chronic liver disease if a baby gets exposed to it during birth or in their very first moments of life. 90% of babies that get exposed to hepatitis B through blood-borne transmission. It's sexual transmission that can happen, IV drug use, blood-borne transmission as well. That's commonly misunderstood based on what we're seeing out on the internet. Just the act of birth can expose a baby, if mom is positive for hepatitis B, to this virus or to this infection. And what does that predispose you to chronic liver disease? So you have to get the birth dose. His 12-year of age guidance is completely erroneous and dangerous.
Yeah, like you said, huge implications for your health. Dr. VIN Gupta, you're always there for us. I know you're so busy, and yet you fit us in. Thank you. Such good information and important information.